على ربكما تكذبان رب المشركين ورب المغربين فبأي آلاء ربكما تكذبان صدق الله العلي العظيم وصدق رسوله النبي الكريم. The translation of the verses which I have recited. In the name of Allah, the most gracious and the most merciful. Allah, the most gracious, it is He who has taught us the Quran. He has created man. He has taught him speech and intelligence. The sun and the moon follow courses exactly computed by Allah. And the herbs and the trees both alike bow in adoration. And the firmament has He raised high, and He has set up the balance of justice, in order that ye may not transgress due balance. So establish weight with justice, and fall not short in the balance. It is He who has spread out the earth for His creations. Therein is fruit and date palms, producing spades and closing dates. Also corn with its leaves and stalk for fodder, and sweet-smelling plants. Then which of the favors of your Lord will ye deny? He created man from sounding clay, like unto pottery, and He created jinns from fire free of smoke. Then which of the favors of your Lord will ye deny? Allah is our Lord of the two easts and the Lord of the two wests. Then which of the favors of your Lord will you deny? Sadaqallahu al-Aliyyul Azim.
Sorry, Dr. Salwa, I think you're still muted. Can you unmute?
Allah subhanahu wa ta'ala accept it from all of us.
Dr. Salwa,
Is everything okay, Familia?
Maybe just start again, Mohammed.
No, I'm
okay.
Now you unmuted. Can you hear me now? Okay. Ibrahim, Jazakallah for the beautiful recitation. You've been cut off at times, but we can't have. There's a technical problem, but you've given a beautiful. Subhanahu wa ta'ala. Month of Muharram, being the 17th of Muharram 1443, the month of Allah subhanahu wa ta'ala, we are blessed to have the seminar in this particular month. May Allah subhanahu wa ta'ala accept it. Before I call on Dr. Mahmoud Baker, just to let you know, Dr. Mahmoud Baker is a very established economist. He has worked in many parts of the world, and we are blessed to have him here. He's Egypt, and I feel he's more South African than Egyptian, a very personal friend of the Islamic Medical Association and mine. He's helped us to an occasion, especially establishing the Islamic Medical Association renal unit that we started at the Shifa Hospital. And even now on, he does help us on an ongoing basis, and also does phenomenal community work in uplifting people's educational needs. Care for the sponsorship, and you may give your message in 5 minutes, please.
Can I start now?
Yes, G.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. I wish to start by thanking my dear friend, Dr. Solwa, and all my friends at the IMA and the staff of IMA for organizing this important workshop or seminar. It came, and it's coming at the right time, this challenge time. We need this indeed. And we are at ICRA very happy and very honored to sponsor it. ICRA, for those of you who didn't hear about it, it's a non-profit organization. We have three main activities. The main activity is we sponsor and we support many organizations in the country. We receive lots of applications. As a donor, we offer grants and donations. We supported more than 1,200 organizations countrywide. And we help on merits. And we have projects everywhere in the country. The second main activity, we support tertiary education. And we support hundreds of students every year to further their academic studies. And we have excellent students. We work with all universities. The third and last main activity is we started to have our own projects. So we work with various universities, and in front of us now, our offices in Hunt Road, the extension of Musgrave Road, opposite Hunt Road Secondary School. We have a very beautiful center. We established it about a year ago. It's called the Iqra Trust Knowledge Center. It's in front of our offices inside the school. You will see it when you pass the street. It's the most advanced and maybe elegant hall in Durban. And I encourage all of you to come to visit us and see the hall. Actually, we are running classes in maths for grade 9, 10, and 11 and 12. We offer the students excellent classes in maths to help them. And we started to have many seminars for the NGO sector and training for teachers, students, and parents. So we will be very happy for any of you to visit us at Iqra Trust in 15 Hunt Road, opposite the school. And this hall is available to everyone at a nominal fee, very small fee. As a non-profit, we don't charge any, we are not for profit. But many people started to use it, many organizations actually. We also have the Orphans Endowment Fund, and Dr. Solwa, my dear friend, and Dr. Fatima, his wife, are one of the supporters for this Orphans Fund, where we do it with the Islamic Relief and the Al Baraka Bank. So again, when you visit us, I will be very happy to meet any of you. Then you will know better about our projects, especially in sustainability. We started to try to safeguard our natural resources by offering solar panel system and batteries to many poor schools. And we have this system at our offices. It saves us lots on our electricity bill. And also it supports us during load sharing. So we work like normal. So this is a very unique system. We do it with the DUT. I'm a trustee at the DUT. So we can do it for any of you as well. As to this, I wanted to finish by I'm a strong believer that man is a multidimensional phenomenon. We are a very complex creature. We have the economic dimension, political dimension, social dimension, spiritual dimension. And the spiritual dimension, I think it's the one you will talk about it, all the speakers today, about faith. Faith, I personally believe, is our main supporter in challenging times like this times. And it's also our supporter when we are alone and we cannot find anyone around us to help us. So faith is very, very important, and I'm sure we will know from the speakers more about that dimension. And again, I wish to thank all of you. I'm very happy to be with you tonight. And again, many thanks to my dear friend, Dr. Solwa. Thank you very much.
Jazakallah khair, Mahmoud, for that beautiful message and the phenomenal work that you do. What the audience is not aware of, that you're a very established musician, but maybe at some other time we'll tell them more about that. Welcome all of you once again. Assalamu alaikum wa rahmatullahi wa barakatuh, and good evening to our non-Muslim attendees also. Welcome to you. We've got a phenomenal seminar organized this evening for you. It's faith and coping with stress and well-being. We really chose this topic. The idea was is that people have been going through really broken and minds. All of us have lost many people from our families and our communities. And besides COVID, we've experienced lots of trauma and lots of loss of life across the world. And the Muslim community, not only the Muslim community, but especially the Muslim community, I would say, has suffered a lot from whatever cause. So that is why see how faith or how our religion, especially Islam here, how do we use Islam in coping with strategies for well-being, and how do we cope? Because everything as we as Muslims believe is from Allah subhanahu wa ta'ala, and that if there are issues, we need to go back to our Creator and address our issues with our Creator. So with those few words, I would like to start this webinar. Ibrahim, and she is a clinical psychologist having a BA from the University of South Africa, a BA honors from UNISA, and an MA clinical psychologist degree from UFS. She is a very established clinical psychologist, and having completed her master's dissertation in the field of coping strategies for healthcare workers. Mrs. Ibrahim has a passion for international conference on wellness in 2005. So I think she is adequately qualified to address us on the subject, and may Allah subhanahu wa ta'ala accept it from her. Nasreen, you're welcome to speak now, please. You've got 20 minutes. Try and do your presentation within 20 minutes, please.
Assalamu alaikum wa rahmatullahi wa barakatuh. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Firstly, I would like to thank Dr. Shakira Kasim for approaching me to speak to you today, and for the IMA for organizing this webinar. Also to our sponsor, Mr. Abu Bakr. Let me just get my slides out. 1 second. All right. Okay, so my topic for today is prayer and mental health. So when I was approached to do this topic, I realized the vastness of this topic. And in the little time that I have today, I'm not sure that I will be able to do it the justice that, you know what, I would like to do it, but I'm most certainly going to try. Now, being a Muslim psychologist and a Muslim mental health care worker, I will obviously be speaking from an Islamic perspective. However, the principles extend to many religions and many faiths. Okay, so basically, an overview of what I will be presenting today. I think before actually going into the principles that are used to enhance mental health, we first have to understand, what does Islam say about mental health? Mental health in general has a stigma, and mental health in Islam sometimes has a stigma as well. So first, I would like to just eradicate that. So negative stereotypes and the fact that unlike physical ailments, these disorders are invisible. And often this is problematic, as these make these disorders taboo or minimized in society. So you might often come across conversations pertaining to things like sadness is shaitan's doing, or a believer never gets sad, or by showing emotion, it means you do not have sabr. Now, let me tell you that nothing could be further from the truth. Statements like these only escalate the process of drowning for these individuals who suffer from depression, anxiety, and hopelessness. So Islam recognizes mental issues and negative emotions, and values the importance of good mental health and emotional well-being. And in today's presentation, I plan to show you exactly evidence for this and how Islam values this, and how much of what we do as mental health practitioners is inevitably guided by Islam. So as evidence for this, there are numerous ways in which Islam guides psychological or mental health principles. But today I will focus on two areas. I plan to focus on two areas, mainly the Holy Quran and the stories of our beloved prophets, in order to outline where there is evidence of mental health problems in Islam. Okay, so if we have to look at the Quran, right? Let's start with science. So if we were to take an MRI scan of the brain, right? The brain, what we would see is that when there is a stressful situation, or when we are fearful, or when we are negative, we would see a sudden stress-producing hormone or neurotransmitter, which impairs logic, reason, communication, and the processing of information. Now, this is how science explains how destructive thought patterns leading to negative emotions and behaviors occur. But lo and behold, long before Western psychology, the language of the Quran described destructive emotions and harmful conditioning in other ways, mainly using the term nafs. Now, we all know lexically, nafs can mean the soul, the psyche, the mind, one's desires, right? And if you look at evidence in the Quran, there are three types of nafs. The first nafs is nafsul amara, which commands evil. Then you get the nafsul lawama, which blames itself, it's self-incriminatory, it steers you away from the sin. And lastly, the nafsul mutma'inna, which is the nafs at peace with itself. Now, as psychologists, we all use many different frameworks when we assess a patient. And I think, for many of us, Freudian concepts has been very controversial. But if there's one thing that I must say from Freud's work, which has been a big breakthrough and a big benefit in psychology, is the psychotherapeutic framework of the id, the ego, and the superego. Now, just listen, just see how amazing this is, how the Quran aligns itself with modern day psychology. So the id is the instinctual and aggressive side of the mind, where you have hidden memories and evil thoughts. Exactly the same as the nafsul amara. Then the ego is the realistic part of the mind that mediates between desires and the superego, which lends hand to the nafsul lawama that blames itself, the nafs that blames itself. And lastly, the superego is the nafs that's at peace with itself, the morality center of the mind, the place that knows right and wrong. So here again, we see how the Quran ties in with mental health issues. And there are some verses from the Quran that are evident of the nafs. So, O mankind, reverence your guardian Lord who created you from an angel nafs, from a single nafs. That's from Surah Al-Nisa. Sorry about that. Okay, and we know that right from the beginning of mankind, when Adam alayhi salam and Hawa alayhi salam were forbidden to eat from the fruit in Jannah, the nafs played a role, their desires. So the nafs becomes a mediator between the spirit, ruh, and the body. And issues in this mediation can cause psychological problems. Just like Freud once hypothesized that the mediation between the id and the superego can cause psychological problems. Another aspect which we are all too familiar with, and that is mentioned in the Quran, is the influence of the shaitan. Muhammad sallallahu alaihi wasallam has said that the shaitan flows through man like blood. All right, so, and we know when we look at certain disorders in psychology, for instance, OCD, when we look at self-esteem, low self-confidence, we see a lot of it comes from strong self-doubt, strong whisperings, which in Islam we call waswasa. All of these come from the shaitan. So in the Quran, and I will discuss this later, using specific verses from the Quran or specific surahs from the Quran to show you that the Quran itself teaches us how to challenge negative thinking, how not to give in to nafs, how to fight the shaitan. And how amazing is it that modern day CBT encourages understanding of self to change current ways and thinking. And it also teaches us tools for maladaptive behavior and thinking, which again aligns itself with Islam. Okay, our prophets, there are numerous stories of them in the Quran. Sadness and fear and other emotions are all human emotions. They are part of what makes us human. No living soul is unfamiliar with these emotions. Every soul tastes sadness, fear, anxiety at some time or the other. So even our prophets, if you look back into history, if you look back into Seerah, they were the most loved ones of Allah, yet they faced sadness, they faced worry, they faced anxiety. Here are just a few examples. Yaqub alayhi salam, when he lost his vision. Yunus alayhi salam, when he was swallowed by a whale. Nuh alayhi salam, when he lost his son. And then of course, our beloved Prophet sallallahu alayhi wasallam was orphaned at a young age, and after he lost his wife and his beloved uncle Abu Talib in the same year, we all famously know that year as the year of sorrow. I know I missed out the second point there. I just wanted to discuss that one a little bit more in detail. Ayyub alayhi salam is probably the best example of a prophet who was afflicted with the most amount of misery and pain. He is known as the prophet of sabr, but yet also of thankfulness. After being bestowed with so much of luxury, so much of wealth, he lost it all. And in addition, he was infected by a repulsive disease. And it is said that there was not a limb on his body that did not have the disease. And there are debates as to how long he had this the disease. Some say years. His wife lamented it. She lost her patience, her sabr. She became old looking after him, but he never gave up. But yet he too faced hardship. So how then can we negate depression or loss of mental health when this existed long before Western psychology even came into play? Okay, so now coming to the crux of the presentation, which is enhancing mental health using Islamic practices. I've decided to break it down in the following way. So first, I will discuss methods of improving mental health from the Quran, and in particular with one particular surah, which is Surah Ad-Duha. I will make mention of other surahs as well, very briefly. And then onto the more practical side of it, I will just be discussing wudu and salah, silence and solitude, zikr, and then of course at the end, some general Islamic tips on dealing with anxiety and depression. Surah Duha, I never realized it until I started preparing for this webinar, is actually the best dua that it probably can be when you lose hope. It's one of my favorite surahs. I think I read it in almost every salah. But I did not realize the power that it had until I studied its translation. So Surah Duha was revealed when Muhammad sallallahu alaihi wasallam had not received revelation for 6 months. He was down, he was low, he was disturbed that his Allah had not spoken to him for 6 months. Imagine this, our Prophet who had so much of tawakkul in Allah Ta'ala, but he could feel low, he could feel sad, he could feel deserted, he felt deserted by Allah Ta'ala. Now, think about our situation at the moment, COVID, the unrest, the losses we are facing, the fears that we are facing with regards to our children going to school. We are having similar times right now. Our feelings are low. Our salah may not be having the impact that we want it to be having. We start questioning who we are. The Prophet was in a similar state. And so the reason for revelation was to reveal to Prophet ﷺ, was to relieve him from negative feelings and to give him hope. So Surah Duha, again, very briefly, because of time constraints, I've broken it down. I've missed out a few verses in between, but I want to try to touch on the ones that can give hope and that can make us realize that Allah is there for us when we are feeling down and in moments of depression. So the first one is Wadduha, which means
Okay, Jazakallah.
Wadduha, which means by the morning brightness. Okay, so the first thing you need to hear when you are depressed is wake up, look at the sunshine. Allah Ta'ala is reminding us right outside, look outside your window. I have the antidote for depression is the sun. Wadduha, look at the morning sun. Everything in life is not doom and gloom. Appreciate the things around you. وَاللَّيْلِ إِذَا سَجَى, and by the night when it covers with darkness. And by the night, this is the reminder that the night is meant for us for comfort. Now, in practice, one of the most important symptoms I see when I do a mental status examination, when a patient comes to me with depression, other than the loneliness, the sadness, the low mood, another significant feature on a depressive person is that they either have insomnia or they have hypersomnia. And how apt is this verse, where Allah is reminding us that He has given us night. He has given us night for comfort. Work during the day and sleep by night. Rest your body, rest your mind. Leave everything to me and sleep. That is what He is saying in Wallayli Iza Saja. Ma wadda'aka rabbuka wa ma qala. Lord has not taken leave of you, nor has He detested you. I am here with you, He is telling our beloved Rasulullah sallallahu alaihi wasallam. Whether you see me, whether I spoke to you, or whether I did not speak to you, I am here with you. The surah goes on for another 2 verses. And then the next 3 verses are very interrelated. أَلَمْ يَجِدْكَ يَتِيمًا فَآوَى وَوَجَدَكَ ضَالًا فَهَدَى وَوَجَدَكَ عَائِلًا فَأَغْنَى. Now here, Allah is saying to us, there are times in our lives when we feel alone, as an orphan does. Allah is there for you. He guides you. There are times when our risk is on the line, where we think, how are we going to make the next day? Where is the finances going to come to us? Remind yourself that Allah is there for you. These ayats show that when a person is depressed, reminding them of Allah has helped them. And in cognitive behavioral therapy, we do the same thing. We try to we encourage patients to have gratitude for all that they do have, rather than focusing on what they do not have. We try to change perception. We try to give hope. In the same way, Allah Ta'ala was giving hope to Rasulullah sallallahu alaihi wasallam. And then He goes on to say, فَأَمَّا الْيَتِيمَ فَلَا تَقْهَرْ. So as for the orphan, do not oppress him. And in the next verse after that, it's similar, and He says, instead of using the word orphan, he uses the word beggar. Now, these verses are the antidote for depression, because here Allah Ta'ala is reminding us, look at the people around you, look at the people who are worse off than you. And again, bringing modern psychology into it, if we use cognitive behavioral therapy principles where we do group therapy, what is the purpose of group therapy? Is to make patients see that there are people with similar type of problems, if not worse. And then the surah ends by وَأَمَّا بِنِعْمَةِ رَبِّكَ فَحَدِّثْ. But as for the favor of your Lord, report it. So this ayat is maintaining that if we constantly renew our faith in Allah, by glorifying Allah, by reading the Quran, by making zikr, by doing dawah, by sitting for talim, then Allah is always close to our hearts. So in a nutshell, Surah Duha, the lessons that we can learn from it in terms of mental health is that trauma or depression are not signs of God hating us. It teaches us to shift perspective using CBT principles like reshaping, reinterpreting, diverting, and the impact of positive thinking. It shows us that taking action can change into a positive mindset, and it teaches us gratitude. You know, I often say to my patients, keep a gratitude journal every day. Write down one thing that was good today instead of focusing on the negative. Okay, as I mentioned before, there are other surahs as well that one can read when experiencing mental health problems. And very briefly, Surah Kawthar. Now, this was revealed to Muhammad sallallahu alaihi wasallam when the Quraysh were taunting him. Allah gave him and his people hope by promising him that if they followed Allah, that they would be able to benefit from the Hawz-e Kawthar in Jannah. And this removed Rasulullah sallallahu alaihi wasallam from his grief. Surah Yusuf. Surah Yusuf was given to the Prophet sallallahu alaihi wasallam after the year of sorrow, to remind the Prophet that he lives in the footsteps of great prophets, namely Yusuf alayhi salam and Dawud alayhi salam. Again, Allah is using examples to show him that there were people before him that also suffered. Again, shifting perspective in order to help and support him. Surah Falak and Surah Nas. Now, these are the two surahs that were revealed to our Prophet sallallahu alaihi wasallam when he was inflicted by black magic. And yes, it is prevalent. Yes, it does occur. And again, it's evident of what we discussed earlier, shaitan. And when I look at my patients, and I've been seeing this a lot nowadays, you know, before it used to be mainly, you know, depression that walks into the office or into the rooms. But nowadays, and I'm sure other mental health practitioners on the forum tonight can vouch for this, we see so much of OCD. OCD regarding salah, OCD regarding wudu. And where does this come from? The whisperings of the shaitan, waswasa. The antidote is simply in Surah Nas and Surah Falak, and conviction that these will fight the shaitan away. Dr. Khan, I was so happy that you actually read Surah Rahman to start off today's presentation with, because it is the ultimate soothing surah for depression. Its melodiousness has a calming effect on the body. It is known to calm someone who has anxiety. So Jazakallah for that. Surah Inshira was also sent to Rasulullah sallallahu alaihi wasallam for solace and comfort. The famous verse comes from Surah Inshira, فَإِنَّ مَعَ الْأُسْرِ يُسْرًا. For indeed with hardship there is ease, promising Rasulullah sallallahu alaihi wasallam that there is always ease. And then of course, not forgetting Ayatul Kursi. The greatness of God is confirmed in Ayatul Kursi, and there again, protection from the shaitan. And last but not least, the heart of the Quran, Surah Yasin. Surah Yasin, Rasulullah sallallahu alaihi wasallam has narrated that one who recites Surah Yasin in the morning, Allah Almighty will be responsible for fulfilling all his needs. Okay, so on to the next aspect is wudu. So in order to attain true peace and khushu, now when I talk about khushu, I'm talking about in normal terms, presence. In psychological terms, mindfulness. So in order to attain true peace or khushu in salah and wudu, involves a level of non-mechanical execution. You know, if we think about how we make wudu and how we make salah, thinking, you know what, I still have to go and see this patient, my children are crying for food, this is happening and that is happening. We just perform salah and wudu like robots. We need being totally present in our wudu and salah can help us with regards to general well-being and mental health. So if one is totally present in the wudu and salah, it can result in strengthening spirituality by giving inner peace. It controls anger and bad thoughts. Rasulullah sallallahu alaihi wasallam has advised, if you are angry, go and make wudu. It can control negative or bad thoughts, and it's a relief for insomnia. Rasulullah sallallahu alaihi wasallam never slept without wudu. It has been said to attain this and keep the shaitan away, keep making shahada in one's mind while making wudu. Or after wudu, recite the shahada and recite the dua after making wudu. Okay, moving on to salah. So gaining khushu or mindfulness or concentration in salah, see salah as something that allows us to leave the world 5 times a day. The moment one hears the azan, start distancing yourself from the world. Mentally prepare yourself to say, this is my time with my creator. Recite Surah Falaq and Surah Nas so that shaitan does not come into your way. Pray tahajjud. Rasulullah sallallahu alaihi wasallam has said the best prayer after the obligatory prayer is the late night prayer, which refers to tahajjud. Read it with intention of fulfilling one's needs. Pour your heart out to Allah Ta'ala at the tahajjud time and ask him for what you desire. Now I know Ibrahim, the biochemistry test, will probably go into movements with regard to salah, so I've left that out of my presentation. But in order to attain full presence in salah, again, the mindfulness aspect, I found these little excerpts from Maulana Shabir Saluji very informative. So he stresses that in qiyam, concentrate on the point of sajda by contemplating that this is the ground from which I was created, thus creating humility in you. You standing before the ground that Allah created you from. In ruku, focus on your toes and remember that this is the first place the ruh will come out from. In sajda, focus on the tip of your nose. And again, remember that this is the first place my body will disintegrate from. And in qaida, focus on your lap and say to yourself, my lap is empty. So if I die now, what do I have to present to Allah Ta'ala? I found this so interesting that I had to share it. So Iblis said in chapter 7 of the Quran, surely I will lie in wait against them, human beings, on your straight path. Then I will come to them from before them, behind them, from their right and from their left. But lo and behold, he did not say from above and from below. And herein lies again the connection that we make with Allah Ta'ala in salah. When we go down in sujood, when we are standing in qiyam and looking in the ground, Iblis cannot come into our path at that time. We know that when we make dua, there is no such thing. We don't have to look up and make dua. But when we say that he missed that part out about above, in essence, it means Allah is above, and all we need to do is look to Allah for help whenever we need help against the shaitan. Okay, so silence and solitude. Now, this is a very interesting one. So some people feel that surrounding themselves by people is best for their mental health. Now, while socializing does have no doubt tremendous mental health benefit, so does being alone. And I often hear depressed patients say to me, I need to be alone. I cannot stand to I cannot stand having people around me. Whilst as clinicians, we have to evaluate the degree to which these statements indicate severe pathology, silence and solitude is also essential for a healthy mind. So it serves as a platform for reflection, for connecting to one's creator, and again, being totally in the present, mindfulness. So while in Islam, we do not always use the term meditation, silence and seclusion is very much part of our religion. If you look at itikaf, for example, and then again, there's also various examples of Anbiya that have gone into solitude. Maryam alayhi salam withdrew from her family. Musa alayhi salam withdrew to a tree before beseeching Allah, and that's where he said, Rabbi inni lima anzalta ilayhi min khairin faqir. My Lord, I am indeed in need of any good you may send to me. Yunus alayhi salam was secluded in the darkness of the whale, and hence came ayat karima, la ilaha illa anta subhanaka inni kuntu minaz zalimin. Yusuf alayhi salam at the bottom of the well, and how can we forget our beloved Rasulullah sallallahu alayhi wasallam secluded himself in a cave before revelation. Okay, so zikr. Now we all are too familiar with this concept, but do we realize how it assists? So it also changes focus. Again, a CBT principle of reframing. And how does it do this? Often what makes us fall into despair is focusing on the sin rather than the merciful, not focusing on being broken, not the mender, focusing on fear, not the protector, focusing on the problem, not the solver. But if we were to wet our lips with the 99 names of Allah, or the name that we need in our time, Ya Rahman, Ya Rahim, if we were to focus on what we need when in our times of need, if we were to continue making zikr, we would find a mind shift, a focus shift, rather than focusing on the problem, to focus on the helper. Another zikr that's very beneficial, which we are all too familiar with, is Durud Sharif. And it is quoted that one of the known cures for a stressful mind is to send salawat on the Prophet ﷺ. This is because for every salawat a person sends, Allah showers them with 10 mercies. Over time, the abundance of mercy acts like a spiritual tranquilizer for the stressful time. How beautiful is that in discussing mental health? Look at those words. Spiritual tranquilizer for the stressful time. So who says Islam negates mental health problems? Okay, so last but not least, just some general practices in dealing with anxiety and depression. So breathing exercises form a lot of what we do in psychology. You know, we often, last slide. Okay, Jazakallah. Breathing exercises form a part of the psychology therapeutic framework. So what better way to incorporate this into your recital of the Quran? And then again, remind yourself about the trials of the Prophet. Musa alayhi salam said, my Lord, I indeed fear. This fear, even standing before Allah, was not buried under layers of shame and hidden under a brittle shield of self-confidence. Musa alayhi salam could openly speak about his feelings and say, I fear. Tawakkul, talk to Allah. Say to Allah, I am handing my fear over to you. But with tawakkul, I must remind you, first establish a plan, then follow through with it, and then put your trust in Allah. Lots of istighfar. I'm not going to elaborate on that. Sleep the way the Prophet ﷺ slept, on the right-hand side with wudu, making shukr for everything that has happened during the day, and leave the rest to Allah Ta'ala. Seek help through sabr. And I know we don't have a lot of time, but I need to say that sabr is often misconstrued as patience. Sabr is not having no emotion. Please stop telling people, do not cry, get over it. Rather, it includes self-control and endurance and a focused struggle to one's goal. Patience implies resignation, but sabr includes a duty to remain steadfast. And last but not least, seek professional help. Here again, Allah has put shifa in hands of professionals. In the times of the prophets, they sought help from Sahaba and from healers and apothecaries. So use the professionals that we are so blessed with to help you during your time of need. Okay, and as a conclusion, worry is a conversation you have with yourself about things you cannot change. Prayer is a conversation you have with Allah about things He can change. Remember, Allah has power over all things. Jazakallah so much for the opportunity.
Jazakallah, Nasreen, for that presentation. It was quite a lot to chew, but alhamdulillah, very important, very pertinent points you brought out, and a reminder to all of us that we need to go back to the Quran and go back to the Hadith and so lace there for our and to share our problems and our needs so that Allah makes it easy for us. Our next speaker is Ibrahim Mir, who has a Bachelor of Sports Science degree in 2013 from the University of KwaZulu-Natal. He also has a Bachelor of Sports Science Honors Biokinetics degree in 2014. And I think he's currently doing his master's. He describes himself about academics, client orientation, very positive. Are you ready with your presentation?
Walaikum salam. I missed a little bit of your introduction, but Jazakallah, and thank you for having me on the show. Thank you to the IMA for giving me an opportunity. I'm just going to try and share my screen quickly just to ensure that everything is working on the technical side. Just give me a second. Okay, tell me if we online and you can see my slides.
We cannot. Okay. Yes, we can. Right. That's it.
Okay, so Assalamu alaikum again to everyone that I missed. I see a lot of familiar names on the list of people attending. Thank you for tuning in. I hope it's informative. Basically, I've been tasked with the topic of motivation and movement. From a biokinetic perspective, this is quite a unique topic in the sense where it's so vast, and I could go on for days talking about motivation and movement. If I can jump straight into the slide, I know it's peak hour in people's homes at the moment, and people are busy, and if you're using one device, for ease of your comfort, I've arranged for most of my points to be on one slide. Also forgive me if I do not stick to the points on slide. I may go off course here or there. Just bear with me, but all I ask is for you to just lend me an ear so you can relate. The first thing I would like to obviously start by saying is that
Yasmin?
In the field of biokinetics,
Yeah, because I'm at a...
We try and, sorry, I'm getting a bit of crossover from someone else's mic. Okay, so in the field of biokinetics, we make a differentiation between physical activity and physical fitness. So I don't know if you guys can see my cursor, but basically physical activity is determined by someone's ability to move around and do activities of daily living without actually stressing out the body to the point where their heart is beating and they're obviously huffing and puffing. So when a person walks into my practice, for example, I would make that differentiation first before going through along and explaining to them what movement is and what's to come of the rehabilitation, etc. So physical fitness, on the other hand, is dependent on various other components. So when I say components, if you get an individual who is basically within their weight norm, within their physical activity levels, and within their physical exercise tolerance levels, you would say that person is sort of physically fit, meaning that they're flexible enough, they're strong enough, they have enough speed, they have enough agility, they have enough power, and their core is functioning properly and is able to do its normal function. When you see declines in physical fitness and problems with certain components, you sort of lead yourself up to injury. So let's take, if you're looking at my first point on my slide, which I'm sure everyone can see, the flexibility of an individual. If you can't reach a particular range of motion. Let's say, for example, you do a simple movement or simple activity like a prayer. For example, salah. If you're not flexible enough, you might not be able to do certain postures correctly. If you adapt it to the real world, your flexibility also determines the extent of the injury that you will suffer, along with your strength. So let's say a person has enough strength, but they don't have enough flexibility. What does it mean for an individual? It basically means that you would be able to basically lift your leg up through a particular range, but because the flexibility is not present, you might overstretch, or you might tear muscle, or you might get a pull. Likewise, this applies to all the other components of your fitness. So people need to understand, when you adopting any movement, when you're adopting any sort of rehabilitation program, exercise regime, anything that you may be doing, make sure you sort of covering all your components of fitness, and they lend to one another in your training, because it will help you to develop muscle symmetry along with proper biomechanics. So that brings me to my next point. The next point being biomechanics and joint forces. Biomechanics is basically your body's levers, your body's musculoskeletal system, and how you're presenting with regards to your movement. Remember, this is not something textbook. Although there are textbook examples of proper and neutral biomechanics, it is quite individualistic, in the sense where people's weights differ, people's heights differ, along with their history, their medical history. So you could get an individual who might be carrying a little bit of extra weight, and that adds on joint forces. But at the same time, if they're at a height where the weight is evenly distributed, you could get away with injuries, etc. However, this leans directly to your posture. So posture is another very important aspect, and I know I've come on air previously quite a bit with regards to posture and salah and movement and biomechanics. It's basically symptoms that present in individuals, and injuries that we're seeing that can be fixed with just little minor changes in training programs, along with your routines. So let's take an individual. I want you to just visualize, if you have what is called a flat foot, or something called pes planus. So basically, this is where your ankle joint sort of caves in slightly and the arches drop. With just one biomechanical change, or biomechanical anomaly, so to say, you could get malalignment of your knee, which will then translate into malalignment of your hip. And then from your hip, obviously, your force distribution is then not normal. And so areas of the body which are not necessarily prone to be taking so much of pressure are now seeing huge amounts of pressure, and then that leads towards injury. So a postural analysis is vital, especially when you're trying to succeed in a particular movement, or in a particular task that you're doing. The principles that we use, which brings me over to my next point, which is something called a fit principle. So remember, the fit, if you have to expand on it, the F stands for frequency, the I stands for intensity, the T stands for type, and then your second T stands for timing. So basically, frequency is how often in your day you want to move or do a particular activity. And then the intensity is how hard or how easy you want to make that activity, which will then determine the type of exercise that you use, along with how long you do that exercise. So things to keep in mind would be that you don't want to be overtraining, as well as you don't want to be undertraining. So keep a nice regime, keep a nice sort of plan out, where you can choose your modes of exercise, and then you can see the muscle adaptations that are happening along with your training. The key to a successful program would be steady and slow progression, which is individualistic and based on the athlete, or based on the individual that is needing a guidance. Remember, these have psychological effects on a person. If your fit principle is off, for example, if someone wants to go to the gym and they want to build muscle and they run consistently on a treadmill, you are covering one component of your fitness, which is your cardiovascular aspect, along with other components, but you might not see gains in your hypertrophy or your cross-sectional size of your muscle increasing because it's a different mode of exercise. But if you change the mode and you go over to a weight machine and you start putting weight on or load on the muscles, you'll see adaptations long term. So things like little things like warm-ups, stretching, cool downs, along with stretching after your activities. These things go a long way in trying to prevent individuals from actually developing further injuries and becoming unmotivated to the point where the injury plagues you and you cannot progress within your sport. So common things that we see in young athletes, in athletes who are coming out, in individuals who are starting an exercise program. If you start too fast or if you start doing movements too quickly, you could lead to certain aspects called slumps, staleness, and burnout. So on my slide, I've mentioned slump, staleness, and burnout. It's more up the avenue of our previous speaker, Nasreen, who I have to commend in the middle of my presentation for doing excellent work in her field. Basically, slump, staleness, and burnout happens in the young athletes and mostly the elite and professional individuals. So these individuals start off at a young age. They basically overtrain, they under recover, and then those lead to psychological effects that can actually damage the individual's potential long term. So if we look through sporting history, throughout football, throughout different sports, you'll find huge iconic players and athletes who had the most amount of potential and the most amount of hope for the future going downhill just solely because their fit principle and their training routines were not within alignment. Remember, the human body is a kinetic chain. So one joint leads to the next joint becoming affected. Something is going to give. So you'll have compensation and you'll have sort of leaning towards different muscle groups for different power outputs if you are going through an injury. If we touch back on what Nasreen was saying with regards to Salah, a person may have the will and the spirit to perform Salah standing, but you're finding nowadays that you're seeing people in chairs. That's more so because from a musculoskeletal point, we are not able to achieve the postures and positions. This is in itself something that can be helped conservatively with basically exercise, stretching, working on all different components. Tying in with the topic again, motivation and movement, I think it works hand in hand. You need motivation to move, and you need to move to be motivated. So it's basically a situation where everyone should go and read up on simple guidelines. The American College of Sports Medicine has recommended that individuals do a minimum of 150 minutes of exercise during a week. So if you break that up across a week of 7 days, you're probably looking at about 15 to 20 minutes per day minimum, where you could just stretch, go for a light jog, do a few sort of repetitions of a particular exercise while focusing on your core. These little changes will sort of give you adaptations, not immediately, but in the near future, you should see little wins, like being able to touch your toes, being able to get down onto the floor. These will obviously help you within your daily life for bending down to tie your shoelace, for easing with back mobility, trying to decrease your fall risk if you are in the elderly category. So across the spectrum, we recommend exercise be done by individuals because it's something that has physiological along with psychological effects, and then it could also better the efficacy of surgeries along with post-surgery recovery. So you're seeing post-surgeries of ACL replacements, you're seeing surgeries where people have had strokes, etc., who are coming in, and just through the movement and the exercise, they become motivated, or through the motivation, you get the movement. So it works hand in hand. And these principles, if followed, obviously will lead to success in sport and will help you to become injury free. The components of fitness that I've mentioned are often neglected by people because of under researching and obviously over enthusiasm by certain patients and certain individuals that will obviously go forth and just start loading or do too much too soon. These sports could include your common ones like running, normal group classes. Remember, with these sort of exercises and these group classes and stuff, you're going to see that you will not get individualistic attention, in the sense where you need to have, maybe if you feel like you have symmetrical muscle development, or you have abnormal biomechanics, or you find that you could benefit from seeing a biokineticist for posture analysis, that would be a great idea. It sort of gives you how much to do, as well as how hard and how intense your session should be. I'm gonna try and keep within time because I know our previous speaker was slightly over. It's pretty basic to the point where people just need to sort of adapt the mindset. I think Nasreen touched on a few aspects of the Quran, which helps a lot to ease depression, anxiety, and obviously other psychological disorders. With those being said, you can use them to get people to start moving again. I've personally seen cases within my practice where people were unmotivated to the point where they were undergoing they had paralysis, and alhamdulillah, by the will of Allah, we've worked with these patients and we've seen about 2 or 3 individuals take individual steps by themselves. So your mind is the sort of the starting point, and then you've got to use the body and the mind in combination to get to particular goals. Without taking too much time, I'd like to just urge your listeners, if anybody has any questions on biokinetics and what we are. A lot of the time people want to know what a biokineticist does. So basically, we are health professionals who concentrate on the scientific prescription of exercise to try and help you to get through your injuries and get through life, obviously through movement and being injury free and symptom free. We help many various conditions such as Parkinson's disease, post-stroke syndromes, post-COVID syndromes, along with other orthopedic and musculoskeletal stuff. Just people out there need to be mindful that your body is a complex machine and your body has various systems, and these systems, once functioning in sync, will allow for movement to be seamless and for you to send power through your body without having any deficits along the way. I hope this enlightens your listeners, and I hope that everyone gained a little bit out of it, and I hope that we all could join in a common thought that motivation and movement, along with the psychological aspects, along with the physiological aspects, will obviously come in time. And I really hope that the next speaker could also enlighten us and give us more insight with regards to the faith aspects of things. From my side, motivation and movement, there's too much, and it's too complex to go into in 20 minutes. So I just probably leave it at that, and leave your floor open for questions, if any. Jazakallah.
Short and succinct presentation. I think you've given us the message of 3 M's by saying that it's mind, movement, mind, motivation, and movement. So it all starts off in the mind, and you've got to start moving, and you'll see enormous benefits. Jazakallah for that good presentation. I think some of the attendees were wanting to know of movements and sort of helping different muscle groups. I'm sure that's available. Both Ibrahim and Nasreen practice at Ahmed Al-Qadi Hospital, and so should you want to see them, they would be available at Ahmed Al-Qadi Hospital. Our last speaker is Dr. Mohammed Ishaq Date, who is a graduate of the University of Cape Town. He did his MBA 2000. where he obtained a DPhil in primary health care. He returned to Cape Town to specialize in internal medicine and currently lectures in health promotion and is involved in community-based projects. Ishaq, you could start your presentation. Jazakallah for being on our program. We feel honored.
Assalamu alaikum.
Ishaq,
Good
can you hear me?
evening. Yes, I can hear you. Can you hear me?
Yes, very clear. You can go ahead.
Okay, Jazakallah. Assalamu alaikum. Good evening, Mulwini, and welcome to everyone. Also a special welcome. I've got some work colleagues also that have joined, people from different faiths. Yeah, I hope that you've enjoyed the presentation so far. So coming on last, I know that everybody's been sitting for an hour, so I can understand people may be feeling a bit tired. So I'm just going to shoot off with an icebreaker. And what I'm going to ask people is, I want you to stand up, wherever you are, stand up. And if you're able to show your videos, also great. Alhamdulillah. If not, also alhamdulillah, that's fine. And I want you to stretch. I want you to reach up, and I want you to reach for your dream. Reach for something that you want to achieve. And I want you to bend down, and I want you to dig it into the floor, dig it. Throw some water over there. And then I want you to watch it grow. So I hope that you've had a bit of a stretch. So this is kind of leading on from Ibrahim. I just want to say thank you again to the Islamic Medical Association for this opportunity. The IMA, as you know, is involved in quite a few amazing projects and endeavors, and in a way, kind of me delivering this talk is a little bit like, shall I say, speaking to the converted as such. I hope that what I'm going to say will help to contribute to the good work that the Islamic Medical Association is doing, and look at how we can build on the work that is happening. So the talk is entitled Faith-Based Health Promotion. We're going to be looking at certain aspects of faith, and we're looking at certain aspects of health. And you'll see I've put a picture of the earth and all hands going around. There's specific reasons why I've done that, and I hope that it will become clearer, as the talk goes along. So I just want us to, first of all, visit what is a very familiar picture in many parts of the country. And in fact, I would say probably in many parts of the world as well. What you see over here on the left-hand side is this very, shall I say, well and neat looking, and looks like a well-off suburb with many different amenities, including a swimming pool. And then on the right-hand side, we see this a suburb over here where there are lots of what looks like already challenges, like overcrowding. We're not sure if they have the same amenities. And if we were to think about the health in these two suburbs, the health we can imagine may be quite different. And if we were to think about what the causes of the ill health is in this particular suburbs, it may be related to education, may be related to policy. I think certainly apartheid would have played a role in our context in creating suburbs like these. But it's also in other parts of the world where there wasn't apartheid, you also see these kind of divides. There are policies regarding housing, economics, environment, spirituality, nutrition, mental and physical health. So if we think about health, and we think about what is it that makes someone healthy, makes someone have good physical health, well, mental health plays a role in it. but also educational health, healthy housing policy, healthy economics, healthy environment. So, what Dr. Mahmoud was speaking about earlier on, this definitely relates to what he was saying. And if we are wanting to improve physical health, we actually need to improve health in all these other domains. And for this, we actually need, people from different sectors to be involved. So we need people from the educational sector. We need people from the government sector. We need people from the spiritual sector and economic sector. Everybody working together in order for us to optimize health in a holistic way. So when I'm going to be speaking about health promotion, I'm going to be speaking about health in that kind of very holistic way that we're trying to optimize. And there are different models of kind of thinking about this. So we call it the biopsychosocial ecologic system. My speakers before me, they spoke about the physical health and biology and the psychological health. And yeah, just to say that if any of you have not seen a biokinesis yet, I do suggest that, we should be seeing biokinesis quite regularly. It's something that I've just come to realize quite recently. But also, if we are not motivated, and if there's an issue at the psychological level, our motivation to do exercise, will certainly be diminished. However, we also need to look at the environment, because if I want to exercise in an environment where gangsterism is rife, it can be actually quite challenging. And we need to look at how we can change the environment in order for us to optimize health. And we can extend this analogy to so many different things. Where many people within the Muslim community have very bad eating habits, besides poor exercise habits. And a lot of these things are culturally related. And of course, there are certain things in certain parts of the world, the geopolitical climate influences health, and so do different aspects of community, family, and parenting influence health. And I'm going to relate this to a chapter which I'm sure most of us are familiar with, and this is a chapter on time, Surah Wal-Asr. And Allah subhanahu wa ta'ala says in the Quran, A'udhu billahi minash shaitanir rajim, Bismillahir Rahmanir Rahim, Wal-Asr, by the passage of time. Verily, humanity is in a state of loss. Except those who have faith and those who do deeds. And they strive when they urge each other towards truth, and they urge each other to patiently persevere. So if I were to take this model that I had earlier on, you can see that, there's also a temporal kind of thing that we need to consider as well. We need to consider the aspect of time, and this is what that surah speaks about, because certainly, our needs are different depending on where we are in our lives. When we are babies, our environment plays a much bigger role in terms of who we are and what we're able to do, compared to when we are older, when we have a greater sense of agency, or we hope to have a greater sense of agency. But there's a few more other aspects of time that I want to speak about. First of all, time itself is extremely valuable. Once time is lost, it can't be regained. Just think about, if we have lost out on the upbringing or the childhood, the growing up of our children, we've been so busy that we've lost out on that. We can't actually get that time back. So time is irreplaceable. In order for us to do good, it also requires time. And it's also easy to be, distracted. There's so many other things that we can do that can waste time. Whether it be, through WhatsApp messages, or through YouTube, or through Netflix, or through, talk that is of very little meaning. And hence, for a large part of the time that we've got on the earth, we are in a state of loss. And we need to look at different ways in which we can address it. And certainly, Nasreen spoke about Salah, prayer, as a good way of spending our time. But I'm going to speak about some of the other things we can do as well. And there's something called Ubuntu Hour, which I will get to again afterwards. There's the concept of faith. Now, in order for us to, first of all, with regards to faith, just to state that I'm a Muslim and I believe in one God, I believe in all the messages, and Muhammad being the final messenger of God. And I also believe, in all the kind of other acts of faith that we can do. But we also to think about faith in the broader sense, that when we are trying to look at those challenges that we are trying to deal with, they're actually quite hard. And we need to have a faith that whatever projects that we're going to be dealing with, that they will have good outcomes, or at least that we try our best in order to achieve those outcomes. So just carrying on, so the act of doing good deeds. Now, good deeds is actually very broad. I mean, just a smile itself is a good deed. And to juxtapose that with doing evil or doing useless deeds. So we have to think about, the project or the work that we're doing. Is it benefiting humanity or is it harming humanity? You have to think about, we have got one earth that we have to share with generations to come. Are we harming this earth? And how can we increase the good work that we are doing? And then the next part of the wasa will have to strive in the path of truth. And just coming to the context of health promotion, there's lots of ways in which we can strive for truth. There's doing research, there's education where we can teach or we can learn. And then there's advocacy as well, where we are striving for truth in different ways. And then what the wasa of the sabr, patiently persevering. And of course, there's an age-old saying, no pain, no gain. And then some people will add, no guts, no glory. Of course, as people of faith, we do things for the sake of the Creator. That's how should be our sole purpose of doing things, is solely for the pleasure of the Creator. And the tasks that we're doing can be very challenging, but we should also bear, in mind, and this comes across in so many different scriptures, that we are not burdened with a trial greater than what we can bear. So now coming on to health promotion, what does health promotion mean? Now, for many people, when they see the word health promotion, they think of one thing, which is health education. They think it's about pamphlets, and that is all what health promotion is. But health promotion is actually a very broad approach. So first of all, I spoke about health in the broader sense, that it's not just about physical health. There is economic health, political health, spiritual health, social health, educational health in so many different domains. And we are trying to promote health in that broader sense. But of course, as individuals, we can't tackle everything. So we need to identify a problem that we want to deal with, that we think that we feel passionate about, in terms of dealing with. And health promotion is actually a whole set of methodologies in terms of trying to deal with a problem in a holistic way. So if we were to think back to the picture, where I show these different communities, if we are to just come in there with an intervention, it's more than likely that intervention is not going to work. So we need to engage with the community that is experiencing the problem. We need to research to what extent, the problem is, and what previous interventions, may have kind of taken place around that problem. We need to study what the policies are around the issue that may be affecting the problem. We need to advocate for policy changes, wherever it's needed. And we need to engage in educational activities with that, whether it's mass media, motivational interviewing, and I'm going to go through each of these points. So first of all, identifying the problem. So let's ask ourselves, what is the problem? So I'm going to just randomly, I'm just thinking about this right now. I haven't thought of it before, but, it is something that I think about at the back of our mind, often, when we break our fast, it's almost like compulsory for us to have samosas. Now, I say this because, I actually picked up weight during Ramadan, and I looked at my HbA1c and it started going up, so that was something I realized, hey, this is something that I'm doing that I actually need to change. So how do we change our diet? that is something, you know, some of us may be passionate about. Do I see myself
Did Dr. Date get cut off?
Okay, sorry, I lost my connection there for a couple of seconds. I'm just going to reshare my slide again. Okay, are you able to hear me?
Yes, we can.
Okay, good. Okay, so we have to be very careful that we're not imposing our own solutions, you know, on the problem. Ideally, we should be learning the language of the communities we are living in, you know, or living with, you know, and it's a question I think we need to ask ourselves: if we are not from an indigenous African community, how many of us can speak indigenous African language? And we need to think about how do we empower communities to become self-sufficient. Okay. We need to do research, and if we think about it, you know, faith communities of the past, we were actually at the forefront of the creation of research, and we need to actually go back to that. And it is through doing research that we're able to understand what is really needed, what interventions work, and what interventions don't. We also need to think about, you know, what the role of policy is. You know, so at the country level, we know that apartheid was a huge problem in this country, and as a result of that, there are many communities that suffered. You know, we need to think about what are the policies within our institutions. You know, are we sitting a lot, for example? What are the policies within our own families? You know, what kind of foods are we consuming? What is our family approach to exercise? What is our personal policies around these different things? We have to think about advocacy, you know, and here, you know, the one saying is that we need to struggle against injustice, even if it's against our own selves. We have to think about education, you know, and here once again they are saying about seeking knowledge, even if it takes us to China, seeking knowledge from the cradle to the grave. Now, there's quite a few kind of things that I can speak about with regards to the theory of health promotion. This particular kind of drawing is from the Ottawa Charter. And this is kind of one of the original kind of emblems regarding health promotion, speaking about different components of health promotion. And if we think about it, a lot of these things we can actually relate to Islam, if not all of it. So there is the development of personal skills and enablement. You know, are we enabled to be able to deal with the challenges that we're dealing with? So whether it is changing our diet, or whether it's exercising, or whether it's, you know, economic challenges. We have to think about mediation. The Prophet ﷺ, he was a great mediator, and how can we encourage that skill? We've spoken about advocacy, spoken about community. You know, to look at how can we create supportive environments? How can we reorientate our services so they become more accessible? So things to ponder about, you know, as we think about how do we deal with these huge challenges. Now, the first thing I want to say is that the challenges that we see, they didn't come overnight. They actually, within South Africa, have come along 300 years. And it's going to take time for us to change this. So we're going to have to do our thing in our limited lifespan that we've got, and we're going to have to kind of pass the baton on and have a strategic way of thinking about how we can change things in the world. But ultimately, you know, let us, you know, instead of complaining about all the challenges that we see in this world, let us try to be the change that we see in the world. And as, alhamdulillah, as we uplift ourselves and our communities, let us also try and raise up others as we're lifting up, so to raise as we lift, or to lift as we raise. And then also to think about how can we dedicate time towards upliftment of our bodies, our minds, our economic selves, our spiritual selves, our environmental selves, and our social selves. The last point, the last kind of point I want to, or slide I want to show is an idea that I'm thinking about, is how can we kind of put into policy for people to actually go out into communities and to look at how we can uplift communities, how we can be involved in social projects. And the thinking that I've got is that, imagine if all of us could dedicate 1 hour per week towards social upliftment, and maybe, let's call it maybe something that everybody can identify, and I'm just use this term Ubuntu hour. So imagine every one of us could have an Ubuntu hours, and in that hour, we actually link up with people from different sectors, with someone from the educational sector, economic sector, environmental sector, political sector, and so many other sectors. And we work together either on a specified geographical area or on a particular issue, but we dedicate the next 10 to 15 years on that issue. Just imagine what we can achieve, in that time. I want to just finish off again with Surah Al-Asr, but this time, in the form of a dua. And my prayer is that, our Creator grants us blessings or barakah in the time that we've got. And that if we are in a state of loss, that our Creator can help us to find ourselves and to find our Creator and to find our purpose, in this world. And for our Creator to increase our faith and to increase our ability to truth. To give us the courage to be able to speak the truth and to find the truth, and to give us the istiqamah and that sense of persistence, that we don't give up when we are facing whatever challenge we are facing. Jazakallah khair. Wal akhiru da'wana alhamdulillah.
Assalamu alaikum, Dr. Salwa. Are you there? We can't hear you.
Okay, is Ishaq, are you?
I'm done with my presentation. So if there are any questions, please feel free. In fact, I mean, I think it'd be great if there can be discussions about how we can achieve these things, if that's possible.
Over to you, Dr. Salwa. We can't hear you.
Shakira, I think there's a problem with Dr. Salwa's mic. I'm not sure if the participants have any questions. Perhaps they can put it into the chat and we could take the questions from the chat.
Dr. Salwa, when you're ready, just come on, please. Okay, I'm just checking the participants' chats. I think one of the questions earlier on, Dr. Salwa, just feel free to come on when you can come on. One of the questions was regarding CPD points. Yes, that will be available, and we are taking a list of the participants. The other question was about biokinetics. Is that you, Dr. Salwa? Okay. And yes, I think we don't want to say one profession over the other. Physiotherapists are also very important. but also I think one needs to see biokinetics. My question to you, Dr. Date, and maybe you could just come on, unmute yourself. I think your idea of Ubuntu Hour and the talks were all very excellent, and it just tied in with each other. And you know, I think with Mr. Baker's presentation initially, and how everyone spoke about first building yourself, and then when you build yourself enough spiritually, physically, you can enhance yourself and then able to help others. And your concept of Ubuntu hours is an excellent idea. And I think you and Mr. Baker really need to get together and see how we can take this forward. And I'm speaking now as the IMA representative, and we'd be very happy to take that idea forward. Are there any other questions on the chat, Femida? I can't see any more. Okay. Okay, wait, I think I've got through the chats. Dr. Solva, you're not out.
Just to come in again, sorry about that,
Okay,
Shakira,
carry
my
on.
internet has been unstable.
Okay.
Did you mention the forthcoming
No, I
seminar?
haven't. No.
Okay,
I
maybe you should do that.
Okay, I'm just seeing if there's any other questions here that we haven't taken. We've got a lot of compliments here for the
Okay, now there's just one question about physios are often wrongly used instead of biokineticists. If anyone agrees with that or wants to take that one.
Reading the questions.
I think, Ibrahim, you want to take that? The question was that
Hello?
seems, yes.
I think Dr. Kassam has answered that very elaborately in the sense where I wouldn't suggest one profession over the other. I think in your phases of rehab, following your injury, you will be instructed either by a physiotherapist or your treating physician as to who to consult with. So I think direction comes from practitioner along with a little bit of patient education. So it's not one over the other. I think it's a sequence that has to be followed. I hope that answers it.
Okay, Dr. Solva, you can go ahead with your vote of thanks, or is there
Yeah.
anything else?
Okay, as I'm sure you can see the upcoming webinars. We've got 3 webinars, one on the 8th, once a weekly injection for cardiovascular protection. And then you've got one on the 22nd of September on hypertension, a new approach in the management of hypertension. And there's a third one also. The one is on the 8th, one is on the 15th, I think, and one is on, the one on the 15th on consanguinity or cousin marriages and public health perspective, something that is extremely important because our own families, interesting seminars. I think I've been cut off for a while, but just to mention again that all 3 presentations were excellent. One tied up with the other. And Nasreen spoke extensively about her clinical practice. And obviously she combined it with extracts from the Quran. And it was an excellent reminder to all of us that we and to Hadith. That motivation of 3 M's about mind,
I think Dr. Solva got muted again. Dr. Solva, if you can unmute yourself.
yeah.
Okay, you unmuted, yes.
Tied into, yeah, and the last one was by Shak, and he looked at it globally and from a country perspective, and the concept of Ubuntu, having a Ubuntu week, Ubuntu day, and linking up with like-minded people and assisting in uplifting the country, because this country is ours. 99.9% of us would not be able to leave, and there is no better country than South Africa. I'm sure many of us would agree. There hasn't been many questions. Very excellent. And I must apologize I think the internet has been unstable. I'm not sure at my end only or at others, but at times the presentations were cut off. We can't help that. We must try and correct that in future. But other than that, I think it was a wonderful evening. We had to cut down the time because it was quite long. We had 3 speakers, and we're very thankful to Dr. the webinar this evening. Is there anything else, Shakira?
Oh, yes,
Sorry,
just a
Dr. Salwa, I think Dr. Date has his hands raised. I don't know if he's got a question or a comment.
I'm not sure whether the exercise he's performing that he mentioned to us is catching up. Dr. Date, do you have a comment or a question?
Yes, I just wanted to make a comment, just to say Jazakallah for this forum as well. I just wanted to make an additional point, is that, one of the biggest challenges that we've got is at policy level. And just from a health promotion point of view, what we try with the NHI coming up, the NHI is very focused on downstream intervention. So, I myself, I work downstream as a physician, but there's only so much that we can treat downstream. We need to plug up upstream, and health promotion is what can help us to plug things upstream. And what the group of us are trying to do is we're trying to look at how we can have health promotion strengthened in the NHI. So just to say that, just to, for people that are on the chat, on the call, it's something that we are hoping to advocate for, and inshallah, we hope to try and get some kind of a petition going, and when we're able to do that, for people to please support that, inshallah.
Inshallah. Should add dentistry as for that event. Eva, we certainly would do that. We'll try to do that. If there's no other comments, I'd just like to say that we had 80 to 90 attendees this evening. That's an excellent show of support. And also that, not to forget that the webinar has been accredited for 1 clinical and 1 ethical point to all those that have attended. We're not going to check how long you attended. That's more. Other questions, we'd lastly like to thank all of you who have participated and to our sponsors for a wonderful presentation this evening. And I think we'll end off with Ibrahim. If Ibrahim is available, he can make the dua. If he's not, you can let me know. Ibrahim, are you available?
Yes, before he gets on, Dr. Salwa, I just want to make a few comments, as part of the Vice President of the IMA on that cap I wear. But more importantly, as one of the members on the coordinating committee of the webinars, and we've seen our IMA webinars, beside all our other activities, they have really taken up very, very well received, and we have people from a diverse community. But even our topics have been very diverse. And if you look at this current webinar, we try to be inclusive of allied health workers and not only a doctor focus. And in future, the idea of dentistry, optometry, etc., anyone else who has an idea and wants to come in, organize themselves, we're happy to give them a platform. And just the last point with Dr. Date is, I think that's the health promotion is also very close to our heart and to many of us. And really, if we could take this further as an IME project as well. Jazakallah, and over to Dr. Khan.
ببركة إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما اللهم صل وسلم على سيدنا محمد وعلى آل سيدنا مولانا محمد وأصحابه وأزواجه وبارك وسلم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام عليك يا رسول النبي الكريم اللهم ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وأدخلنا الجنة مع الأبرار يا عزيز يا غفار يا رب العالمين اللهم ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين رب جلني مقيم الصلاة ومن ذريتي ربنا وتقبل دعاء ربنا اغفر لي ولوالدي وللمؤمنين يوم يقوم الحساب اللهم أعنا على ذكرك وشكرك وحسن عبادتك اللهم افتح لنا بالخير واختم لنا بالخير واجعل واقب أمورنا بالخير بيدك الخير إنك على كل شيء قدير بفضل سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين.
Dr. Salwa, a very big thank you to Fahmida as well, and to you. Any last words?
Gee, I think that's our main support, background support, and Fahmida has always been coming to our rescue. Jazakallah, Fahmida, and to yourself, teamwork that makes these things possible. Umma wa bihamdik, ashhadu an la ilaha illa ant, astaghfiruka wa atubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh. Sorry to take up so much of your time. It's now 9:15, and a bid you favor. Jazakallah. Assalamu alaikum.
Wa alaikum salam.